Good evening, everybody. I'm happy to be opening this virtual plenary session of the Health Data Interest Group at the time of COVID. So it's very special conditions. It's virtual, unfortunately, but still it's useful that we can get together. And we are going to speak about transparency and trust in health data. The agenda implies that I will be speaking first on current difficulties in trustfully and lawfully sharing anonymous and pseudonymous health data. Then there will be Yanis speaking on special complexities in dealing with brain data. And last but not least, Leslie, who will be speaking on how to guarantee effective transparency on data used by biomedical researchers in their publications and by pharma companies in clinical trials. And then we will have a answers and open discussion on the further themes to be discussed by our interest group for the next plenary 17. Hopefully, no more a virtual plenary. Okay. So transparency in healthcare is a huge issue. It touches on so many points that it's really a difficult and threatening topic to touch upon. It deals with the quality of healthcare, so the transparency of providers' performance measures like quality of outcomes, quality of processes. It deals with the patient experience, patient perceptions, and their experience and outcomes. It deals with the cost of healthcare. So there are the problems of the cost transparency, for instance, the diagnosis-related groups in many public healthcare systems. It deals with the problem of governance, the open decision-making, rights and responsibilities, resource allocation, such a huge issue now regarding the vaccine, regarding ventilators in emergency units and so on, the accountability mechanism. Transparency deals with the personal healthcare data. I will focus just on this. So the access, the ownership, if there's an ownership of the data, this is the very debated issue, and the personal data protection. And lastly, the transparency deals with the problem of the communication of healthcare data, the extent to which all the above is currently accessible, reliable, and usable by all relevant stakeholders. There are a lot of ranks trying to establish what is the position occupied by each country, but I won't go into this. The amount of transparency. We'll see that there are many problems that we'll just focus on a few of them today, but I will focus on the one concerning the personal healthcare data. And before going there, I want to add the point that there is, as we all know, a huge potential of artificial intelligence and big data for healthcare innovation, which adds to the traditional issue of the personal health data. Because starting from a large and variety amount of data, artificial intelligence algorithms are able to identify complex patterns of relationships that can escape human researchers, and algorithm machines enable to automatically perform millions of operations per second once a rigorous logical definition of what is the problem at stake has been attained, minimizing human errors and hugely reducing costs. And what comes with this is the fact that we have data-driven analytic, the so-called data-driven analytical paradigm, because big data contribute not only to verify theoretical hypotheses with statistical techniques, but also to explore new scenarios and derive new theories, as well as more generally to discover new knowledge. Some scholars even speak of a real scientific revolution compared to the classical hypothesis model experiment approach. But there is the other side of this. So there is the fact that we have unpredictability by design and black boxes connected with artificial intelligence. Because the process of algorithmic production of knowledge is quite often unpredictable by design. because being normally based on big data analytics, testing large numbers of algorithms on the data, and in view of discovering meaningful correlations on which machine learning causality or differential or deep learning infer, this may produce the so-called black box effect, with the risk of rendering automated decision-making inscrutable or prone to hidden biases through, though apparently functioning. And hence the request for algorithms that respect the so-called FAT principles: fairness, accountability, and transparency gain. And hence the whole ongoing debate on artificial intelligence ethics and algorithm explainability. So given this as a background, let's move to the inconvenient truth we have to face in discussing about personal health data, is that data sharing in healthcare remains rare. It is characterized by high transaction costs. It happens mostly under private agreements typically enacted by large corporations. Although available data is continuously expanding, it largely sits idle, fragmented in silos, carefully guarded by data controllers to reduce legal exposure. And if we take into account the more complex regulation at the time, now also California has joined in with something similar, but it is the General Data Protection Regulation enacted by the European Union. This draws a dividing line between personal data and non-personal data, which is paramount of application of this protection law. Personal data are subject to the regulation, non-personal data are not. And anonymous data fall outside the scope of the General Data Protection Regulation. There is a discrepancy, however, in the way anonymization is referred to in this General Data Protection Regulation and in the European Data Protection Board. For the GDPR, it is on a risk-based approach, as personal data rendered anonymous in such a manner that the data subject is no longer identifiable by all the means reasonably likely to be used. But for the European Data Protection Board, anonymization results come only from processing personal data to irreversibly prevent identification. So there's no element of likeliness as in the first, so it's more absolute. And the subsequently regulatory uncertainty, at least in Europe, makes it extremely difficult to obtain anonymized data from clinical institutions, also because of the new heavy sanctions falling on non-compliant data controllers. The other method of protecting privacy according to the General Data Protection Regulation is pseudonymization. It relates to the processing of health data in ways by which they can no longer be attributed to a specific data subject without the use of additional information, provided that such additional information is kept separately and is subject to technical and organizational measures to ensure that data are not attributed to an identified or identifiable natural person. As re-identifiable, even encrypted data, which are highly protected, but are considered are pseudonymous and are personal data. So given their identifiability and therefore qualifying as personal data, all pseudonymous data require in principle a specific legal ground, such as an explicit personal consent, as well as the provision of specific information to the data subject for being lawfully shared with third parties, even for research purposes. There are possibilities of sharing for research purposes based on another legal basis, which is a special national law allowing for this, but this complicates things when it becomes cross-border. So there are still a number of problems there, even just for research purposes. So anyway, using pseudonymous data is something which is quite complex, and it becomes a burdensome exercise, because research or pharma companies receiving the downloaded pseudonymous data become, to all effects, the data controllers of those data with all implied accountability obligations, such as transparency, data retention, minimization, privacy impact assessment, data security, right to be forgotten. In these conditions, the sharing of pseudonymous data likely results in a burdensome exercise, as I was saying. So we have, considering this, we have devised two ways of overcoming possibly at least part of these difficulties at the moment, which make it so difficult to have the real an effective sharing of health data. One is what we call the visiting mode, and it is spreading around. Many subjects, many entities are working on this, which means bringing the algorithms to the data, not the data to the algorithms, without disclosing neither the data nor the algorithms, allowing to perform secure computations whose results are the only released outcome. And there are three tools which have been trying to do this. One is homomorphic encryption, so the fact of being able to have computations on encrypted data without decrypting the data, which is extremely important, extremely significant, especially in areas where data would otherwise be absolutely revealing the identification of the subject. There is secure multi-party computation, where you can divide the number of elements composing a data sets into a number of parties who each have only elements, partial elements, and nothing allowing to have a full picture. And they come together afterwards. They each does the computation on the elements they have got, and the outcome is only readable from the whole. This is a complex system. It works pretty well, and this is the basis for federated learning, where you have different entities concerning and developing models for having the possibility of applying these models of artificial intelligence or machine learning on the data. This is interesting, but there are current limitations. The visiting mode, and more generally the area of privacy-preserving machine learning, is certainly an emerging field in data science. As yet, the foundation on either homomorphic encryption or secure multi-party computation still implies a large communication and computation overhead, which makes it hard to use where very large amounts of data are required, since communication and computation costs are greatly affected by the increase of the number of involved parties or of the model's complexity. So an alternative is given by synthetic data. Synthetic data are fully artificial data, which achieve anonymity by breaking the link between the private information and the data's information content. They are automatically generated by making use of generative adversarial networks based on two models playing recursively against each other. You have the generator generating new artificial data, and the discriminator saying, no, these are not correct, this must be fake, and so on, until the thing gets a balance, and the discriminator cannot say anymore that the new data don't appear as the original one. So you have artificial data, and high quality synthetic data closely resemble the real data and are a suitable substitute for processing and for analysis. Oh, what have I done? Something. There is the possibility of applying to the algorithms generating the data a differential privacy. And this has been especially studied by a challenge launched in 2019 by the National Institute of Standards and Technology in the United States, which says that differentially private synthetic data generation is a mathematical theory and set of computational techniques that provide a method of identifying data sets under the restriction of a quantifiable level of privacy loss. It is a rapidly growing field in computer science, And so this provides, if applied, a mathematical foundation to privacy definitions, thanks to the capacity of differential privacy to establish this mathematical value. This approach is now being observed and considered with attention. For instance, the very last document published this month by the Big Data Value Association, it's a white paper called Artificial Intelligence in Healthcare, states that many researchers find unclear the approaches that are required to collect anonymized data to ensure final users' privacy. Generative adversarial networks can generate meaningful synthetic data which do not suffer from the confidentiality constraints of the source data. EU-funded projects are synthetic data data sets that sufficiently resemble source data while avoiding privacy issues. And generative adversarial networks have demonstrated potential, but their general applicability has not been established yet. So the conclusion I come to is that there's a possible next step, which should be considered by our interest group, because the time, I think, is ripe for initiatives that clarify legal and technical definitions and the difficulties of coping with health data sharing while fully implementing regulations as strict as the General Data Protection Regulation. This should be done with the aim of prompting private and institutional centers to work on the potential of synthetic data and secure computation systems, suggesting a roadmap for their further implementation and market adoption. This would be a stepping stone to foster the activation of a thriving digital ecosystem for the biomedical sciences. So this is from my part on this first theme concerning transparency, but I now stop sharing my screen and I invite Yanis to join in with his second presentation.
Okay. Let me now try to share my screen.
It's a green button. Have you seen
it? Yes. Yeah. Let's. I know that the button, the issues with my presentation. Okay, let's see. Okay, let's see. Should be this. Share. Is it shared?
Well done, yes.
Okay, wow.
You just need to make it full screen. Full screen. Okay, perfect.
Okay. So, what I will describe to you, let me get rid of this as well. Okay, what I need to describe, what I intend to describe, I should say, is issues on the more technical level of the kind that Edwin presented in the broader Human Brain Project. The Human Brain Project is a very big investment in Europe to study, to prepare an infrastructure that will host and offer services on data services, computation services, and specialized scientific services related to the human brain. It's a 10-year investment, which will end in 2023. And as part of that, of course, data play a very big role in that. And the issue is, what do we do with issues of privacy and so on and so forth? So I will present a little bit some of the tools that exist in the Human Brain Project, which, by the way, the infrastructure that is coming out of the Human Brain Project is called eBrains, which does stand for European Brain Infrastructure for something and something. And so I will discuss these issues in this broader context. One of the tools is a medical informatics platform, which is clinical medical data, and that is its target, called MIP. And then the general human brain project. Okay, so just very quickly, the medical informatics platform is open source software to be installed in hospitals or research centers at universities, but the primary target is hospitals, so we can have actual clinical data. And currently it is installed in 30 hospitals, and by 2023, the goal is to reach at least 60 hospitals. And of course, installed doesn't mean that all of them have data that they offer, but we're getting there. Some do and some don't. And it includes a whole bunch of tools. And the key element is we have the MIP system, the medical informatics platform, installed in hospitals to be used locally. And this has a quote unquote simple data privacy and issues. But even more importantly, the thing is to offer them in a federated way, so that a federated user can analyze data that comes from multiple hospitals, and that's a network is a key challenge, in another order of magnitude in terms of the challenges. And so in a hospital, you have a server that hosts the local version, and then you have another server that holds the federated version, and therefore which is the only one unconnected, disconnected from everything else at the hospital, talking to the network. And the thing is that you have to, besides the technological challenges, there are other challenges as well. Well, build the hospital federation to convince the hospitals to go with that way, a major challenge. Then implementing algorithms with privacy awareness, which means that only aggregates of data beyond a certain size of that contributes to the aggregation is allowed. So it cannot be an aggregate of 2, because then privacy is jeopardized very quickly, and no true data is revealed. And of course, there's a lot until we reach that point. There is a lot of things that are happening before the data is prepared for processing, and to clean it, to curate it, to anonymize it, which is the first level before the processing. And in general, a complex data wrangling pipeline that is in every local level until it reaches the point to be transferred for federated use. And we have been operating, as I said, a network of 30 hospitals, with some of them actually offering data at a federated level and piloting the use of that. But already, although the MIP is currently still under development, and I'll explain later the work that we were doing in the privacy level. Already there is interest, and we are collaborating with colleagues across the Atlantic with a US Brain initiative and the CARTA Consortium, which is the Center for Accelerated Real-Time Analytics in the US of Maryland, and of course the Brain initiative, because they have not similar systems, but in any case they have brain data, and they are processing them, and they are storing them, and they are protecting them in certain ways. So we are also looking at the cross-platform interactions and privacy preservations. This is, for the time being, just talk, but I just want to show you the prospect and where we're heading. So if we go into the MIP privacy, as I said, currently we have aggregation-based analytics, only aggregates of at least 10 or 12, depending on the parameter setting. Patients go out of the hospital, but there is also the need, and we are currently looking into this, how you can achieve this when you care about a particular patient and you want to find similar cases elsewhere. And then what does privacy mean? And how can you secure privacy while still try to treat a single patient. That's work under development. One thing I should say is that in the beginning there may be a question: why should you federate data? I mean, you have a hospital and you see lots of patients. Sooner or later, you'll have many patients. Well, there are other reasons, but one primary reason is to address rare diseases. And rare diseases, in order to have statistically significant set of patients, and in order to compare and come up with trends and signatures of diseases and so on, you need many more patients than what you can see in one hospital or even in one country. And that makes the requirement to federate clinical data. So in order to move ahead and do more advanced, we go into more advanced privacy preserving technology, cryptographic tools, and secure multi-party computation for computational privacy, and coming up with for the output privacy, working with differential privacy that also Edwin mentioned. So the goal in this second version, if you want, the next generation version of the MIP, is to have strong guarantees, privacy guarantees, that currently the current system doesn't have, just operating with aggregates. And with respect to computational privacy, we are working with secure multi-party computation. It's a distributed protocol where the raw data is never published, and all is learned is the output. And therefore, the output, of course, you can decide if you want the real output or a private output, and that's output privacy. These are two orthogonal levels of privacy. So you want to take sensitive data that is partitioned across hospitals, a federation of hospitals in this case, and with potentially distrustful data controllers. This is a main role, how to do that. And we're doing it with SMPC, and we're using secret sharing, and by using, I won't go into the technology, but there are technologies, and we have moved them, we have used them to set up a way so that data from multiple hospitals, they are sent around outside the network with using the secret sharing algorithm, and all the computations are done, and then a true result comes back without anyone ever seeing any of the data that is here, even not just anonymous data. So technology is here, but and there are many more advances to happen. Of course, I'm not saying it's a done deal. Still, more techniques are coming up, more challenges in different issues, scalability, and so on and so forth. But the Human Brain Project, but there are also non-technical challenges. And just to give you a glimpse, of course, we have a data protection officer. We have to have it by the new regulations. And there is the Human Brain Project is a very big project. It has 130 plus partners. It's a nightmare. And there is a specialized data governance working group that decides what are the right policies and procedures in order to do the most effective use of the data, including the issues of privacy. This is just to show you, and there are of course generic issues that you need to deal with, but also particular issues to deal with by the fact that you're using human brain data. And the human brain data is a lot of imaging, and also a lot of parameters, both spatial parameters in the brain, but also particular measurements that are happening in this liquid and the other element of where is what around the brain. And the pipelines to bring them to use are extremely complicated. And here you see what it takes for you to register a data set in the brain. I mean, data is entering, and it's a lot of stages before it's finally registered in the Human Brain Project, in the data repositories that is done. Lots of annotation, cleaning, as I said, matching and connecting with ontologies or control vocabularies so that search may be facilitated, and then various technological things until we get into and issues of openness or closeness. The goal is for open access, but there's always the issues of embargo and so on. So this is a complicated pipeline to get to that. And eventually, in the Human Brain Project, including the clinical data that I mentioned, but also just the research data that exists in many other ways, because the research data may be based on actual data, it has to be privacy has to be made sure that is offered. And there is a eBrain's knowledge graph with lots of both clinical and research data on the human brain, and independent of the privacy, mapping data from one brain to a data from another brain so that you can correlate and identify and analyze and identify trends and so on. It's a technological challenge in itself, because every instrument that measures the brain is different. It is differently calibrated. The map of a brain, there are different maps of the brain, and how each point maps to in one system versus the other. So lots of such work is happening in HPP during to achieve such integration. And I just said what it says, that they're extremely heterogeneous, acquired different protocols, and there is a whole large team of specialists, curators, like in museums. Here we have special data curators and data stewards that take all this data and bring it to the point of making it useful. And not only should the data be anonymized and processed with techniques that I mentioned, but also as this data is integrated and mapped to vocabularies, ontology, and so on, there are possible dangers that through these processes, even quote unquote anonymous data may be eponymized, may lose part of their privacy. So this is something that we need to be taking care of. So I'll stop there. I wanted to give you a glimpse of what is happening in a large European initiative with connections, discussions, however you're going to call them, with the rest of the world. And the challenges that we have in dealing with data in general and some privacy and trust issues in particular. Thank you very much.
Thank you, Yanis. And I am going to try to share. Oh, yeah, I think, yep. Let me try again. So there are a lot of great questions in the chat. We are going to hold off and try to answer those afterwards. So be sure and save who you're asking your question for, because we're each taking a little bit of a different approach on this. So I am going to scale out a bit and really talk more towards the trust and transparency and how that relates initially to science, but I'll delve in more from getting from the science into the publication. So I call this data available upon request, and you'll see why in a little bit. So let me see, there we go. Let's first start with science. So just for us, science may not be confusing, but for a lot of people it is, because it's, well, and even for those of us who are in science, it can be confusing because there's a lot of key stakeholders, the researchers, librarians, the publishing system, academic institutions, funding institutions, and consumers, each with different roles to play. And one of the great things about RDA is that we come together in these different roles to talk about what it is we can do to make science better, to make data sharing and interoperability better. So that's what the angle I'm taking. But let's get into talking about trust. So for those of you who were able to go to the wonderful International Data Week in Gaborone, I just wanted to bring back that memory. But I also wanted to tell you a little bit of a story. So I was able to attend this, and what we would do is we would eat outside. And of course, there are wildlife outside because it's just that way. And there are these monkeys. So as it happened, I happened to be swindled by these monkeys, and they played this game. They played the game where two monkeys would distract you and entertain you sort of, and a third one would come up and steal your food. And in this case, they stole my croissant. And a couple of years later, I'm still a little bit upset that I was duped. So how in the world does this relate to trust and science? So trust is about believing that someone would do what they say they will do. There's a contract of trust implicitly that exists among functioning societies. And that was my issue with the monkeys. They are not part of our societal contract of trust, but we are. So how do we work with that? How do we support trusting science? The angle that I'm taking is we need to check the quality of science, whether it be healthcare or not, and this is definitely going to focus on healthcare, but how do we check it? And I would say at a much higher level, we need to look for quality indicators that currently are in our publications. So author identifiers, the study objective, data availability, code sharing, ethical approval, funding sources. And this goes on and much deeper, right? So if we're talking about how do we trust a clinical trial, there are quality indicators for that. But I really want to just start at a much higher level and think about transparency as a solution at this higher level, because I would say transparency is where reproducibility begins. And it doesn't mean that everything has to be accessible, all the information, but the information should be made transparently. So let's take 3 things that really help with reproducibility. This is data, code, and software. So let's play find the data for a second. So as many of you know, data availability statements are becoming more and more required with publishers. They're expected by funders. And one of the things that I started looking at with the company that I started is, well, how many data availability statements are there, and where are people actually sharing the data? And the majority of publications right now say something like data are available upon request, or if they're trying to either be really polite or really snarky, we're not sure, they would say under a reasonable request, although I'm still not sure what a reasonable request is. But let's look at how that could change and the difference between with justification and without justification. So here's an example of someone who said the reason for data not being available and how you could get it. It's still a bit cumbersome, and we'll talk about, the issues with this. I think COVID brought it right to our attention, is that you don't really have time to request data when you really need it. And what if this person's actually a clinician working in the hospital and doesn't have time to go back and find the data? Nonetheless, there's at least a justification. And this ties into trust. This actually would make me more believe that the person would be willing to share the data and that they worked on the data if there's a justification. But the fact of the matter remains, data really are not available. And I'll show you what I mean. And we are talking, by the way, I'm not necessarily talking about the raw data. I'm just talking about any data, the summary data, the questionnaires, all of that's very important. And by the way, I'm just going to say two things about this email thing because it is a little bit of a pet peeve of mine. Having to request data creates gatekeepers, and gatekeeping will have biases. So that actually reduces the trust. And which researcher do you know, this is point 2, which researcher do you know that really likes to answer emails? So there's my other thing with doing the emails. But let's look at a couple of research. This is a PLOS study, and this is from 2009, but I do, it needs to be done, but it get redone, but it gives you some information about how hard it is to actually get data once you request it. And this was just out of 10 initial requests for data. And you can see that they did not come up with very many. There was one person that was willing to share data. In another study this is a Cell paper, they examined the availability of data from 516 studies between 2 and 22 years old. And basically, odds of getting a data set, having it exist, fell by 17% per year. And the odds of being able to contact the author fell by 7% each year. So these are not great. This talks to us needing to do something to improve the trust of our science and the trust of data. So the next thing I want to just take you to is thinking back on the availability of data. So if we have a data availability statement, or if we're thinking about sharing data, here are really the 7 broad buckets that we've put in, and this is, I say we, but there is some publication out there about how people share data. External repositories in an article or supplementary file, online, within a paper, not publicly available, upon request and not applicable. And these last 3 we're looking at, and we use machine learning to pull these out of publications, but we're looking at if they give a justification or not, because that actually starts tying into understanding how we both can share data and how we can trust the work of scientists. By the way, the not applicable is an interesting one. Basically, people say it doesn't apply, we don't have any data. I have seen one in a STEM fields where it was a computer science one, and they generated their own data with the code. So it actually was true. It didn't apply that they would have their data, but they did share their code. So that was awesome. So what's next? This is just some examples of what it would look like, data sharing in supplementary files. And I say this because when you're trying to train a machine learning model on it, it's very important to go in and use named entity recognition and the like to go in and find what you're looking for so that you can pull it out. Here is an example, and this is from Welcome Open Press, from the data being in an external repository, or and them actually requiring how they would have to share data. So basically what this brings home is data availability statements does not mean that data are available. And I'm going to give you a little bit more data, which is, here are some 5 journals, and all who have policies on data availability statements, and you can see that they vary, and I anonymized them. Actually, I just obscured them. I know which ones are which, but how the data availability statements have been doing. Not probably surprising to many, though, when you start looking at the journals by impact factor, it doesn't really matter. Some have lower impact factors than others, and it doesn't mean that you're going to get more data availability statements. But then when we looked in a little further, the availability of data does not correlate with data availability statements. So there's a lot of work for us to keep doing. So part of the take-home message is we need to improve. If we improve quality, it also improves efficiency. And I'm going to give you some COVID preprint examples. So in March of 2020, I kid you not, in bioRxiv and medRxiv, there were 535 preprints on COVID. Okay, within a few months, that was up to 5,000. And I think that, actually, I don't know what it is right now, but there's not necessarily another order of magnitude, but they've been coming out at an exponential rate. So here's what you can start doing, or what we started doing, to look at trust in the the research. So not only we go back to those quality indicators and look to see if things have something like have a study objective. And you would think that every research article has a hypothesis, but that is not what we have found. About 80% do that are machine readable, and about 90% do when we do human annotations. Authorship is something we're looking at. Number 4, by the way, is if they have an ORCID ID that's populated, because there are ORCIDs that are not. Do they have a funding statement? So again, we're looking at trust, data availability statement, data location, and code availability. So these are just examples, but as you can see, as we go further into the granularity, we can make certain assumptions about in total whether we can trust it and whether we'd want to use it. So here are 4. I think you're going to get the take-home message on one of these already. Is sorry, I meant to take out the company name on everything, but here's how that kind of ranked if you scored them over all of them. The first one ranked pretty low. They didn't have enough of the quality indicators. The next one, medium, and then one of them on the potential vaccine targets made it actually scored pretty high. It had a lot of these quality indicators in it. What was the outcome though? The first one actually was withdrawn, and this is correlation, this is not causation. The second one, I think everyone knows at this point, the hydroxychloroquine has definitely been questioned. The researchers on the ABO blood group, if you're not familiar with that research, I honestly thought it was a pretty good study, but it was overhyped. And then the last one was, it has been published. Just one note though, if you'll look at the citations, obviously just because the way that it scores on quality indicators does not correlate to the number of publications. Obviously there's other places affecting that. Let's see, a couple more things. One is, I thought this was kind of interesting, is that the majority of the preprint analysis said that the data were online and not available upon request. Now, this is different than what we've been seeing, which is over 70% usually say data available upon request. So this was very different early on with COVID preprints saying that the data were online already, not necessarily in an external repository. The other thing that we looked at was just if we scored things, this is the pink in the background, and I really should work on colorblind colors. My apologies for everyone. The one in the background are those preprints that have not been published, and those in the front have been. And what I want to draw your attention to is there are a few right there in the background that haven't been published, but they actually scored really well. And some of those are modeling ones that modeled the spread of COVID. So I think they're very important, but there are ways that we can start looking at science and looking at the quality. So what are my take-home messages? First, attention does not equal quality. Second, we do need to make science fast. We need to make it open, and we need to figure out how to check it. And then my little mantra, to make better science, we need to make better science easier, and we need to make it easier for all. So to move into our discussion, for my part, is how do we look at trusting science? There are quality indicators. What are the things that we need to be talking about and from my perspective, from a high level? I think this also brings us back to what Giannis and Edwin were talking about getting into the more granular ways of looking at data that can be shared and what can we do there. But before we get to the discussion, I want to bring 2 things up on the clinical side. And that is, which I have nothing to do with either one of these initiatives, I'm just also a big fan of them, is there is an initiative in pharma to make their data more open. And so I would encourage you to look at the Open Pharma initiative if you're not familiar with it, because there is a movement there, as there has been in academia, to make their data more available. And then Vivly, which is an organization, a nonprofit organization working towards being able to share clinical data in a private manner, but also link to it and have persistent identifiers to that information. So I wanted to make sure I pointed those out before we went into our discussion. So thank you very much. I'm Leslie McIntosh. I do have some slides up on Figshare, but I can also share this presentation as well. I mean, this version is mostly up on Figshare. So thanks.
Okay. So thank you, Leslie. Thank you, Yanis. So now the floor is open for questions. I've seen that there were a lot of them which have been handled somehow in the chats. But anyway, I think that it would be better to speak out and come with new questions, or even discuss better the ones which have already been indicated there. So, an intervention from the attendees?
Can I start maybe?
Please. Absolutely.
Here is Dmitry Shigel from GBIF Secretariat. Thank you very much, Leslie. Great talk, and it resonates with so many things we struggle with biodiversity data and the data citation. Yeah, I'm just super impressed by your summary of the issues, and it's sort of a relief also to see that in the health sector, the problems are very similar to what we face in biodiversity data. So one thing that we discovered, we promote data citation through DOI and so on, so we can direct credit to the data originators. So this is sort of an additional aspect to what you covered when people share their own data together with their studies. But sometimes they use the external data too, and then things become interesting. Often it's a combination of own and somebody's else, and so on and so on. So, but I totally agree with you with the gatekeepers, and I would like to ask you, what would be your take on this kind of carrot and stick dilemma on how to change the academic norm? Yes, if journal requires you to have your data out, you will do that. Otherwise, your manuscript doesn't go into the review. So this is kind of a stick thing. But many journals in biodiversity domain don't do that. Like good guys do that. Not so good guys are welcome to skip the step and publish without any data visible anywhere, not even upon request. It's just not there. And so I'm looking for solutions how we can drive the culture change in an efficient way without being too hard on the stick approach, but I don't have too much trust on the carrots either. So maybe you can advise.
Sure. Well, thank you. Thank you for your compliments, and thank you for your input. One of the things going back kind of to the original idea is that we need to get the stakeholders together. I will say we actually just finished a project with the Wellcome Trust, who started looking at how they were doing and looked at these indicators. So that is specifically working with a funder who is starting to potentially make changes. And that's still the stick, if you will. But to your point, publishers are one point, you know, and if they require it, people will do it. And if they don't, people tend to not, because it is a lot of work. Funders doing it is very important. And I do think that we have to make it both easier for researchers and also somehow known that the more all the research points to, the more you have your data out available and ready to use for other people, the more likely you are to get cited with that. So we have to keep the conversations going with all of the stakeholders. And I'll just do a quick plug for the librarians in the room too, because they do a fantastic job of working on this as well. To your point, what we're working on, sorry, your earlier point, just between whether the data that you consume and the data that you put out, we're working on an algorithm to differentiate those two right now. The other differentiator is the IDs, whether it's a persistent identifier or whether it's just an identifier. And so algorithmically, you know, from a human perspective, particularly if you work with a data librarian, you can figure those out. But from a machine perspective, there's some tricky pieces to that we're trying to, you know, get up the F1 score so that those algorithms improve. So there's a question, just since I'm on, and then I know there's questions for Edwin and Giannis, but Rebecca asked, is there an API to give me trustworthy badge based on my Orcid data? That actually we have not done yet, but there is work, we are working with a publisher to work on this idea of a badge. So that's an interesting idea, Rebecca. And it gives us a reason to chat offline.
So,
I had a quick question for Leslie as well, if that's all right.
Please, go ahead.
Hi, Leslie, do you think the high levels of data availability you saw for the COVID preprints was due to the welcome statement, or was it actually due to the high profile retractions due to lack of data, or what do you think the reason was?
You know what I think it is, and I don't have empirical evidence on this. I think it's because we have been talking about open data, that it has become the cultural norm, that people were able to start moving in that direction, because these are all preprints. No publisher required anyone to put things out in these preprints, and things started changing from when they were before. And I think the conversation has helped a lot. That's my angle, because I haven't figured out anything else. It was definitely not a stick. And a lot of people, we actually broke it down into those that had funding and those that didn't. And there's a lot of altruistic people out there as well who didn't have funding to do what they did, and they still put publications out there. Or you're assuming they didn't, you know, if they're being honest. So. I think Rob has his hand up, and then Andreas.
Yeah, thank you. It was really nice. I am very much in favor of funders. Of course, for the COVID-19, that didn't help in the first months because the funders didn't have an influence on the first months of research there. But funders and data management plans are a much earlier way of guaranteeing something. Also, if the data management plans actually are judged before the research is started. I am regularly looking in the Netherlands at data management plans, and I'm really trying to help, out of the name of the funder, the researchers to do the right thing. So for instance, if they say the data will be available on request from the PI, we suggest to them, maybe you have to use a data access committee and at least document how the data, what the conditions will be under which the data will be available. And that really helps. Now, for the COVID-19, I think you should also ask Dawei. Dawei is also in the call here, and he told me at the beginning of the COVID-19 crisis that he had really big problem actually locating data, even though it was supposed to be available according to the papers in the preprints. Thank you.
Thanks, Rob. Dawei, I don't know what if you want to speak up. I should have been clear that people making it available it's kind of like the data availability statement. It gets them to think about making the data available, but I think it was the last keynote speaker to Juan who was talking about, you know, just because the data are there, it could be a pie chart. You know, what people called as data is questionable, but we're moving in the right direction. And that went from 500 to 5,000 within a few more months. I mean, and those data have been more available. But just to draw attention back to what Giannis and Edwin were talking about earlier, I think what they're working on at a very granular level or a more granular level really would help with making the data available and usable upon request not upon request, excuse me, but when we need it. Because we do have to think about those very serious issues about privacy and anonymity.
Yeah, I just wanted to highlight exactly in the same direction, because with all this push towards open data, while laudable in general, we need to be aware there will always be a lot of data that simply cannot be made openly and publicly available, or that cannot be shared. I mean, we have a setting in the medical domain where it's not just that access to the data needs to be granted, but it also is only granted for answering very specific questions. So even the same data being used for a different question would not be tolerable. And so I think that while we definitely should push for, as open as possible and keep that mandate going, I think work that allows data not to be shared, but to be made accessible, so data visiting services in encrypted form or in strictly controlled, trusted environments, where each interaction with the data is strictly monitored so that you can track if somebody tried to analyze something from the data that was not part of the research question, for example. Whether such environments shouldn't be receiving at least as much attention, at least to counter the usual excuse that we see. And so I can't give you my data because it's privacy sensitive, thus I cannot share it, thus you have to send me an email. And to have a kind of counterbalance to this openness regime.
So I personally would agree on that. I will say that the researchers I've seen that I think do a phenomenal job provide code, regardless if they can share their data, and they provide the code. And someone had talked about this. What about synthetic data, the real fake data, right? Using synthetic data in real code to show you how it would work, which has a lot of applicability in other settings. And then when you can use that, let's put it that way. That's not, none of these are silver bullets. None of these can be used for all situations, but I do think our attention to just the data also hinders some of the progress, and we should put some of the light on code. But I'll let, I've been answering questions, so Edwin or Yannis, please chime in on your thoughts as well.
Well, there's a lot of interest on your talks, so I think it's good that you go on answering that.
One thing, if I may, to add to that, having just code without data, let me put it in extreme, is useless. Having data without code, well, you can build the code on top of it. So I think that the true, and I'm exaggerating, don't quote me on this or jump on what I'm saying, but I think it is, I think it is, you're right, Leslie, people are more relaxed in sharing code than data, probably because there is more value associated with the data than the code. And it's more expensive to generate data, much data anyway, than to generate code. And I guess that this is a duality that we see. And with respect to the previous thing about what is the carrot and the stick, and your answer, Leslie, and so on, it's work in progress to change the sticks and the carrots. And I think the entire community involved in I shouldn't say just research, but in general, in our data-based society as it evolves, moving from individuality to community is a big step, and it takes time. And it will require some sticks, and it requires some carrots. And in the academic world, very little. Some deans and some fields are considering taking into account such things in their evaluation of people. On the other side, we know many journals, especially in the bio field, that request your data before they publish your paper. And so I think it's work in progress, and it will come along. And sharing your data, and with respect to openness that Andreas brought up, I think you raised it as a question, but you kind of gave the direction of an answer in my mind. Open science, open access is about openness, not necessarily about lack of privacy. You can be open, in protected data that is very realistic, and you can do your research and you can find whatever you want. In many cases, not in all cases, without sacrificing on the privacy, while being true open. So although openness and privacy are seemingly orthogonal, not orthogonal actually, opposing issues, I think we can bring them close to orthogonal, that you can have open and private, open and not private, and so on and so forth. With more work, of course, we're not there yet.
I see David Lin has raised his hand.
Yeah, can you hear me okay?
Yes.
Oh, good. Yeah, I think first I want to address what Bob brought up, that at the initial of the pandemic, it was difficult to share data. I think that it is somewhat, I think, a combination of logistics and then kind of the way the philosophy of people share data, because there is a lot of research and clinician that they're really kind of focused on saving lives. You know, like the sort of like the data is a add-on at the point. So I think that probably is also a call for innovation, that, you know, how we can get a data without interrupt the people's workflow. I think that's kind of one point. And the other point I want to raise is, I think, is trying to comment on the trust of the data. I think kind of Leslie mentioned that part. And when we like organize the recommendations and guidelines for COVID-19 clinical data sharing, I think one lesson we learned is that it's not just people open and share data, but also share data responsibly. And then one way actually can leverage the current infrastructure is to work with the trustworthy data repositories and to share data through them, because they will look into, you know, the metadata, the different requirements, the quality of data, and then when you share data, you trust those data. And I think that's also, I think, the experience that we work with import. So we I think send out hundreds of requests to the paper authors and to see if we can share with the data. And there was a lot of data is on Figshare. It's not like the people don't share the data. They share the data, but some of the qualities is just not that worth the trouble to kind of curate it. And right now, I think we share like 4 COVID data sets that, you know, they working with the authors to get their data curated. So in a sense, I think is that I think I just want to mention that, you know, the trust also need to work with different partners to make sure the data is out there. You know, will have impact instead of give people the wrong impression, like, you know, something happened or not.
We ask for another question and then we go back. There is Anne Cambon.
Yes, hello. David, hello, David, said part of what I wanted to say, so that's fine. We work together in this COVID-19 working group in the clinical aspect. But what I wanted to say is that when you have data, where you have clinical data or personal data, it's usually only part of the data that needs a high level of restricted access. And what is complicated is to make the choice between what can be shared without putting problems on the privacy of the people and what needs really to be upon request or being protected. So some elements in the metadata giving information on that could be also a help for the committees that well, regulate or give the access or not to the data. And I think that the easy way to go is I have personal data, I don't give access. But in the data sets, there are a mixture of personal data, less personal data, and data that could be used by others without putting any problem for the patient. So I think that's the granularity to which we declare that something has to be upon request to a committee or be available. It's not necessarily a full data set. So I would like your views on that and how to address that.
I would say something on the metadata. We have had another experience with a blockchain-based system where the data were off-chain. The blockchain was recording all the transactions, but there was a metadata catalog so that in fact you could always see what data were available, and also to answer some points were being discussed in the chats regarding the consent. Was there consent to share this data on certain basis to certain partners or not? So the metadata could define all these elements without giving access to the data, but allowing to know where they are, if these are available, if they can be requested, and so on, and on what conditions. So I think that the metadata approach can be powerful. It needs an infrastructure on which to be applied.
I think people liked Anne's comments, so thank you. Also a note about sensitive data are not only personal data, which is, I certainly, will do a +1 on that one as well, that we really focus on the law, the legal part, but not necessarily the ethics. And for those of you who don't know about the Indigenous Data Sovereignty Group within RDA, they bring a very different perspective about data rights from a more of a public health and a societal view rather than an individual view. And I'll just make a comment too about the metadata. It actually, to me, gets back to, it's not the same. So those of you who are, I know the difference between code and metadata, but when people share code, it's amazing what information you get about the data that aren't just shared with the data. So Giannis, I think that gets back into the, you put it so eloquently about data without code and code without data, but you do end up getting more information with the code if you can get it. Again, neither one solves all problems.
Absolutely. It's the value that is added when you have the second one of whatever you had first is immense, no doubt. And because sometimes you have data, and if it's without metadata, then you don't know how you can use it. And if you have some code, by analyzing the code, which is of course not a walk in the park, you can understand possibly, and you can extract meaning and purpose of the data itself. But yeah, both are very valuable.
Yeah.
The data may be hardest to get. That's.
Although I did have one statistician who would not share his code because he said it was his and his alone. So, it all depends.
Well, I'm sure there are cases where, there is IP, important IP hidden in code, and people want to capitalize on that. And that's reasonable, acceptable. No doubt about that. But in most cases, it's a code. Sharing your code is better for you as well, together with everyone else. Can see the code, can interpret, and can reuse and build on top of it, and so on. Yeah, there are some cases where it's reasonable to hold on to your code because you'll become Bill Gates or Jeff Bezos or whatever. But in most cases, sharing the code is a better thing.
Yeah. A couple of just housekeeping things. I noticed that Mark posted a question about looking for anyone in today's session working on EU data spaces in healthcare. If you are here to look to connect with people just because we're not in person, please make sure to put something in the chat to try to connect, because RDA usually works on it. It's where we come, you know, I say where the data geeks come to socialize, but make sure you put that in there. The other thing though is, Anne and Dawe, I think your hands are still up, but I think that's because you have to lower your hand, or we have to. But Matt, do you have a new? Okay, so then Matt has a question.
Yeah, so I had a question for Yanis, and I thought the presentation that you gave was really interesting, talking about how you can prepare all this brain images for sharing amongst researchers. My role is with a publishing company, so preparing journals and setting data sharing policies. I wondered what would happen if somebody wanted to publish a paper based on those images, and whether it would be possible to share any of the data that's come through that initiative or not, based on all the work that you're doing.
I don't have a definite answer to your question. A lot of it is about imaging, but the image is the raw data, the data that is being shared. You know, you do a lot of image processing and analysis and so on and so forth, and you end up with numerical data of the size of this and the length of that, and the density of X and Y and Z. So there are hundreds of parameters that are extracted from the images. And then, but even that, I mean, in the beginning, naively, I would say, okay, the fact that your lobe is that many millimeters as opposed to that millimeters, how can you identify who it is? And yet they were saying that combination of a bunch of parameters of your brain can identify who you are. They're unique. It's like your retina or your fingerprint. So that's why we go into more advanced privacy preserving techniques. But sharing, I mean, you can publish on this data, of course. Now sharing the actual data that you used, I mean, if it comes from the federated world, even you use encrypted data to come up with a result. So, as I said, I don't have a direct answer. I'm thinking aloud here. Probably there are ways, there are versions of the data that you can share, and together with your publication or independent of a publication, that is privacy preserving to a large extent. You know, the guarantee is 10 to the minus something, and then others can use it in the same spirit that you get hospital data from other hospitals. So it should be for the publication itself. That would be my top of my head answer.
Yanis,
yeah.
When it comes to imaging, in fact, you have to use pseudonymous data because this is what is safe. So you have a key to go to decrypt the data, and of course you can share them, but it is cumbersome, as we have seen, because there are a number of constraints attached to this. The difficulty is having anonymized data on imaging data, unless you use really synthetic data, because because of the things you were saying, that it is so, there are tools by which you can reconstruct to which category they belong, and so on. So the fact of de-identifying as imaging data is quite complex, and I wonder whether for this the only solution is not synthetic data with differential privacy.
I don't know if it's the only solution, but definitely a very good solution that we can use and work on to make it achieve. I absolutely agree with you.
We have 5 more minutes, so last questions or comments?
What are the low-hanging fruits that we can pick until next time?
An orange.
I do want to bring up the question that was asked earlier, but he brought it back up about synthetic data being used. But at some point, do we have to shift to real data? Which there was a little bit of a debate on
This
that.
was in the chat. Yeah, I forgot about it.
Okay.
Yeah?
And I think I came in and having, from my experience, you definitely have to move to real data if you can at some point, because otherwise you're making judgment based on the synthetic data, which is just that, is synthetic and has its limitations, but other people may have other views on that.
We have had some experiences of applying synthetic data in decision support systems, and they work perfectly well as real data. So there are things where this has yet to be analyzed and validated more extensively, but apparently the synthetic data can work substituting real data on many things. They can be used especially for building systems in which you use artificial intelligence, so you can build up data sets which are used for training the algorithms for having big data, which otherwise it is so difficult to have, because it is difficult to share, to put together data from different sites. So my general take on this would be, if you use synthetic data, you get to understand the problem, and then you go back to the real data if needed. And you also know with whom you are sharing, because there's trust and there's things have been developing. But in the first case, you can do a lot of work with anybody with synthetic data, because there you risk nothing. That is certainly anonymous.
So given that, and that we have a few minutes, I think there's some discussion, but it seems like we should write that down as something to maybe carry through to the next RDA, which will be around the corner before we know it in Edinburgh, to think about the uses of synthetic data. And I personally would like to bring back in trust and transparency when it comes. That would be a nice tie-in as well, with understanding trust and transparency using synthetic data. Just thinking of taking notes for next time.
Yeah. Indeed.
I agree. If a title is synthetic health data, with everything that this brings, the questions that were asked with respect to going back to real data, what you just said, Leslie, about trust and so on. I think focusing on synthetic health data would be a nice topic next time. It's not low-hanging fruit, Andy, but well, we may have to climb a little bit. It's exciting fruit.
I agree.
Well, Andy can help us in this, for sure. Okay, so I think we are now come to the end of our time. I would like to thank Leslie, Yanis, and everybody who has been attending. Thank you so much. Notwithstanding COVID, we have been able to have some interesting discussions this evening. And so the appointment now is to next time, possibly in Edinburgh.
Let's hope.
So everyone stay safe. Thanks so much.
Bye-bye.
Thank you. Bye-bye.